Thank you for joining us. Among the many subjects we cover, one of the most important concerns certainly is that of our health. The Healthy Masters International Conference in Portugal just took place recently, and the keynote on a clinical trial update was presented by Bill Faloon. With the acceleration of scientific research, the following is very exciting and compelling.
Thank you for those kind words. And I'm going to bring up the current dilemma that we're facing. Now, the good news is thousands of people today are engaging in experimental age reversal interventions. These are people emulating what's going on in the animal model where aging is being slowed and meaningfully reversed. The question is, how do we validate which intervention is working and how well it may be working? How are we supposed to do that when you've got thousands of people following literally hundreds of different protocols? Well, we go back in history and look at Franklin Roosevelt. He died at age 63, but there was a roadmap that was developed after his death to try to figure out how to prevent other people from perishing the same way. Franklin Roosevelt, like so many other people, he had high blood pressure in the early 1900s, actually. And it was so common back then, people just assumed it was normal and there was nothing you could do about it. And so by age 50, he had chronic systemic high blood pressure. It was damaging his vasculature. It grew worse during his presidency, developed heart failure. In 1945, he suffered a cerebral hemorrhage type stroke due to all of those decades of high blood pressure. And his blood pressure was over 300 millimeters of mercury systolic by the time he died. Can you imagine walking around with a 300 blood pressure reading when ideal levels are 115 or lower? But back in those days, people had these outlandishly high blood pressure levels, and there was nothing they knew to prevent or treat it. It was very challenging. So FDR died at age 63. And here I'm turning age 67 this year. I'm doing more than I've ever done in my life. And he was unable to sustain his life because there was nothing they could do at that time to treat hypertension. It wasn't even recognized as a degenerative illness. Well, because of this untimely death of the president, a lot of people thought, let's try to identify what's causing people to die from these vascular-related diseases, these heart attacks, these strokes, the leading causes of death today even. And what they did is they designed the Framingham Heart Study. Learning from history, we want to emulate that. And Framingham began in 1948 in a little city in Massachusetts. And what their objective was to follow a large group of people over a multi-decade period to identify what causes heart attacks, what causes strokes. And they were able to identify underlying factors in the development of atherosclerosis and the horrific effects that hypertension inflicts in people. So because of Framingham, we're saving tens of millions of lives around the world today. And so this information, good information, Framingham Heart Study starts in 1948. It's still going on. They're following the grandchildren of the original Framingham participants to see how well they're doing in preventing heart disease or engaging in habits that are increasing their risk of cardiovascular disorders. So you look at people who were unable to benefit from that. Lyndon Johnson died just 1 year after FDR, and he had his first heart attack in 1955. And this is when Framingham was just gathering data. They didn't know how to prevent heart attack back then. He suffered chronic angina pain, and he resigned from the re-election in 1968 at the age of 59. Can you imagine being washed up at age 59 because your coronary arteries are blocked and just walking across the room creates some chest pain? Well, that was his predicament, and he died a couple years later at the age of 64 in 1973. This is before the Framingham information was brought into clinical practice. Well, look at what happened starting in 1980. A huge decrease in cardiovascular deaths because the doctors figured out how to better treat it. I'm going to give some other examples too as to what caused people to stop dying from heart attack as much as they used to be. But you look at these current presidents, every single one of them would probably have expired by now from heart disease. You look at Bill Clinton, he had bypass surgery in 2004, had a stent put in 2010. Well, if he was living in the era of Roosevelt or Lyndon Johnson, that technology just didn't exist. George W. Bush had a serious coronary blockage. A stent was put in, and he's okay. You look at all the technology that enabled Dick Cheney to stay alive. These three former leaders of our country are only alive because of biomedical technology. And our argument is the technology to slow and reverse aging exists right now. We just have to figure out how to implement it, how to validate it, so we make sure we're doing everything the proper way. So here are some of the reasons for this 50% decline in cardiac deaths. This is what we're doing now to avoid having heart attacks at the age of 40 and 50, which was common back in the 1940s, 1950s, and 1960s. It was very common. This is what we're doing now. This is some of what our life extension group did to contribute to the decline in cardiovascular deaths. We identified DHEA as a hormone replacement that can reduce vascular illnesses, homocysteine reduction. Low-dose aspirin is a secondary way of preventing heart attacks in people who've already had cardiovascular disease. CoQ10, public access to blood tests, and we defined reference ranges. Back when we started, hypertension wasn't diagnosed until systolic exceeded 150 to 159 millimeters of mercury. That was way too high. We advocated that systolic should be under 20. We've since been validated to be correct on that. And you look at the decline in heart failure rates starting in 1995. This is when people started taking care of themselves better and conventional medicine improved. This huge decline in sudden death in heart failure patients. And I use these analogies because we know people are prematurely aging to death today, right now, while existing therapies exist. What we have to do is validate those therapies. So the prospect of human age reversal, it grows closer every single day. But the problem is, lots of people are self-experimenting, and we don't have a central way of gathering data and then analyzing that data to evaluate how well these therapies are working. So this is the predicament we're in right now. Lots of good people, and we love you all for doing it, by the way. You are self-experimenting. You're going to doctors that we refer you to, or many other physicians who are prescribing anti-aging medications, hormone replacements, intermittent fasting regimes are being practiced. It's fantastic. But how can we rapidly assess what's really working, what's partially working, what may not be working at all? We need to start going in the right direction. Well, the solution is emulate what they did with the Framingham heart study. Validate what works to delay or reverse biological aging. And Framingham did that. They identified what causes coronary atherosclerosis, and then identified ways in which people followed certain lifestyles, and they did not have the heart attack rates as people who weren't doing it. So you look at these similarities. Franklin Delano Roosevelt, his death in 1945, hypertension, well, we got millions of people dying from aging today. 1945, though, hypertension was not even recognized as a disease. Good news is aging is slowly being recognized as a disease, and the cause of hypertension, 1945, not well understood. Well, we understand a lot more about aging today than what they knew about hypertension in 1945. And progress began in treating hypertension in the 1950s. It wasn't very good in the 1950s, but at least they made some progress. We, on the other hand, 2021, are discovering numerous, myriad ways of dealing with aging and circumventing its pathological processes. So we want to emulate what was done in Framingham. And in order to do that, well, we need to investigate, validate, and disseminate information. We need to validate what is working, baseline and annual follow-ups, so we can ascertain what is enabling people to slow and or reverse their aging process. The Vitality and Aging longitudinal study, I am funding this 100% myself. It involved a lot of money being put into the computer software, the staff that's running this thing full-time. This study is being operated on a full-time basis, available to everyone, long-term, ongoing. We have no preset termination date. We want to follow people for an indefinite period of time. And this is now only available in the United States, by the way. We've had a lot of people in other countries want to participate. At the moment, only in the United States. For people who travel here once a year, it's fine. But basically, it's all available online. You enter your basic information, health questionnaire, and then there's an age management blood test panel, including an omega-3 test kit. That costs $495. It costs a lot more to do the commercial tests that are included in this panel. Very simple to enroll in this study. That then enables us to not lose data. That if you experiment with some sort of exosomes or, let's say, umbilical cord plasma or many, many other therapies that appear to be working, by the way, we want to know how well they're working. We need to gather this information. We need to investigate, validate, and disseminate information about what you're doing to extend your lifespan and share that with our group. So the cost of the test panel that we put together at a commercial lab is over $3,000. We're making it available for $495 only to participants in the Vitality and Aging longitudinal study. We are not making any money on this, I hope you understand. I'm putting my own money into it because I need to gather the data, have our experts evaluate it, and then publish and determine and ascertain in a way so our group understands these therapies are working, these are working a little, and some of them aren't working at all. We absolutely have to do this with a group of several thousand people. We've got several hundred enrolled in this study right now. We need to bump it up to several thousand to get statistically significant improvements. Now, here's an example of why this is so important. November 2020, hyperbaric oxygen, a very aggressive therapy, was shown to increase telomere length and decrease some markers of immune senescence. That's fantastic. And it generated international publicity. The aging process in people went in reverse. This is what was published around November 18th to November 25th, aging going in reverse. Major publications talking about people's telomeres lengthening, their immune systems improving in response to a very aggressive oxygen protocol in which people not only underwent the therapy with a hyperbaric, they also had pure oxygen they were breathing in. Telomeres elongated 20%. Senescent immune cells declined 37%. Some improvement in immune markers. Hey, this all sounds fantastic, doesn't it? Look at this. The media talking about scientists discovering a way to reverse aging in humans, and the telomeres of the trial participants, they actually extended to a point where they were 25 years younger. That all sounds great, but, well, number one, it's expensive. This is the cost at the clinic in Central Florida, if you wanted to go there to have this done. If you want to just go to a local hyperbaric treatment center and go through this very grueling regime, it's 5 days a week for 3 months. It'll cost you about $18,000. It's a lot of money. And the question is it worth your time? Well, unfortunately, despite all the data they gathered, it wasn't nearly enough. And Reason came up with a critique of this study, and we agree with a lot of what he said. And that is, they didn't do a significant, comprehensive baseline measure of aging in these people and then follow them up after the 3 months of hyperbaric to know if we really were seeing aging go in reverse. We didn't know that. All they did is show telomere elongation, and they showed some improvements in the senescent cell category of immunity. In other words, the immune system's senescent cells, which are significant, were reduced. But that's all. We needed to find out, did these people really go in reverse as far as their aging process? And this is where the Vitality and Aging longitudinal study comes in. If someone wants to undergo a 3-month aggressive hyperbaric oxygen chamber therapy, please get the baseline measurements, $495 for all of these comprehensive tests, undergo the therapy for 3 months, and then do another test. Let's see if they really put you in reverse from the standpoint of a comprehensive set of biomarkers. So the dilemma we're currently faced with today, which is much better than we were 6 years ago, where we had virtually nothing. We've got lots and lots of members now participating in clinical trials, self-experimenting, but we need to validate what's working. We need to reach a consensus of what we should be doing, we being the whole group, everyone listening to this broadcast. We want to be able to be on the same path. If we know there's a system to slow or reverse aging, well, we want to all follow the same path. We don't want to be going in many, many different directions. Now, the good news is an anti-aging clinical trials facility that I'm mostly funding in the Villages, this is in Central Florida, lots and lots of retired people who are in reasonably good health. We're going to be doing lots and lots of pilot studies with many, many interventions to see which ones are working, which ones are not. We've got a medical clinic set up there, all kind of expensive equipment. We've got a lab with its own mass spectrometer. We were able to draw blood and get results that day from people that would normally take months with commercial labs. So we're in fantastic shape with our anti-aging trials clinical facility. This is the Better Humans group that we've been funding now for the last 3 or 4 years, and there's 3 or 4 other people putting significant money into this research group because they are doing clinical trials nonstop and then providing us with the data and also anyone else, frankly, good solid data as to what we should be doing. Our Human Age Reversal Project, this is funding another clinical trial called the Intervention Study. We're up over $1 million in funding. That's all the money that's come in, by the way, to fund the research. I am funding the overhead of this particular study. So the money there will be used for the medications, the blood tests, the physician fees. That will only be used to pay the hard cost of a trial that we're going to be announcing very soon in a major way. Good news, it's fully funded. We've got a full-time staff working to move it forward. If you want to donate to that study, by the way, the more money we have, the more tests we can do, the more interventions we can do. This is the place to donate money. And some incredible news, Dr. Barzilai, he is the pioneer of the Metformin study that the FDA approved in 2015, and it obtained about $70 million of funding. He's going to study metformin on about 3,000 people over a multi-year period, but he's also interacting with some interesting people, and they plan to donate every year, and this is an announcement that he's hoping to make very soon, $1 billion. $1 billion every year to stop aging. These are some ultra-wealthy people who realize they've got enough money to put that money together in a chest, a pot, let's say, and just shotgun that out to scientists around the world to figure out a way to keep us alive. So what we have to do now is stay alive to benefit from this kind of research. And the problem is the delays. We have bureaucratic delays that impede our ability to do rapid-fire clinical trials. This is a major problem. And one of those problems is the FDA. It's just the way they operate. They require a lot of documentation before they approve a clinical trial. We need to reform that. We need to go to Congress and literally change the law so we can do more trials in a faster way. So a summary of the experimental therapies that most of our supporters are engaged in. I know there's a lot of other ones, but we're boosting AMPK with metformin or other AMPK activators. We're reducing our senescent cell burden with dasatinib, quercetin, fisetin, replenishing NAD with infusions, patches, precursors, suppressing excess mTOR with rapamycin or intermittent fasting, and of course resveratrol just to express our sirtuins so we can benefit from the NAD and doing everything we can. And then our more progressive members, they're advancing into exosomes, perinatal tissues, growth hormone for a year, trying to regenerate the thymic gland, and other types of therapies that appear to be working in the animal model. We want to see how well they work in humans. So if you're going to try to ascertain if something is working, we need baseline age management blood test results that go into our database. And then when you undergo a series of age reversal interventions, then come in for a follow-up. It's $495 per test. Then you see how well something is working. And we've had people who run down to Panama and other places. They undergo very expensive therapies, and they come back and they'll ask me, well, I'm not sure if it worked or not. And then I'll have to ask them, well, didn't you do a bunch of blood tests first and then went down and then did the same blood test after? And most of them admit they just didn't have time. Well, if you don't have time to measure the effects of something, then you'll never know how well it really worked. Again, the tragedy of lost data. We've got hundreds of people who, had they done extensive blood testing first and then run down to other countries and gotten some of these stem cell therapies, we'd know right now which ones work and which ones don't. So again, this age management blood test panel, you can pay commercial labs $3,000 for it, or if you participate in our longitudinal study, $495. And again, this is not a profit maker for me. I want the data. The money simply is subsidizing the high cost of the test. And this is what's included in these tests. The age management panel, you see some of the conventional risk factors. We look at these added risk factors. We want to make sure no one suffers a cardiovascular event that we could have prevented if we can identify risk factors. The omega-3 index, you want to make sure your EPA, DHA levels in your body balance with the omega-6s. And this is a test that absolutely gives us the information we need to know that you have optimal fatty acid balance. We're going to look at glycemic markers, of course. If we can improve insulin A1C, glucose levels over a period of 6 months to a year, we have a good feeling we're putting aging in the right direction. Of course, hormones. There's no reason for everyone not to restore hormones to a youthful level, because hormones enable cells to communicate with each other. And we could do some real good anti-aging research and only find out that there's a hormone problem that circumvented the benefits. And of course, we have to see how your kidneys and liver is functioning in response to an experimental therapy. Are we seeing improvements? Are we seeing injury? We want to know that. That's why we include this. Of course, the minerals, easy to supplement with. Make sure that you are there perfectly with your mineral balance so that we can make sure that we're doing the basics. We want to make sure that at least the basics are there, including your ability to carry oxygen. A lot of older people suffer subclinical anemia, and they're tired, they're not working as well with their brain, and all they need to do is correct an anemic problem. And of course, immune cell counts. This is just a simple immune cell test that we'll be doing, but at least we'll be able to rule out some of the problems that people have with immune senescence. And of course, for men, PSA. We want to make sure someone with prostate cancer is going to follow up and get treatment. And there are treatments, by the way, nowadays that are virtually outpatient. You go into the doctor's office, they treat it in a way that you'll have dinner with the doctor that night. Side effects are so minimal, it's no longer a big deal. So the age management blood test panel, you can pay a lot of money for it at a commercial lab. Our Vitality and Aging price, which is heavily subsidized, $495. VitalityandAging.org is where you log in to participate in this study, where we'll get your data. We'll keep you up to date with what we're doing. You can determine what you want to do. Again, our objective is to identify a validated protocol of different interventions that enables us all to be on the same path, and then we then experiment in different ways, but we at least have a foundation of age control that currently doesn't exist. We can't say that everything we're doing now is producing the results we'd like to do. So again, the charity supporting a massive intervention trial that you can donate to is the Human Age Reversal Project's 501c3 organization. And this PowerPoint slide that I've just put on should be available on our age-reversal.net website. You can also enroll on this website if you want periodic age reversal updates. Age reversal updates that I send out about every 3 weeks to keep you entertained. So that pretty much concludes my clinical trial update. Thank you.
I looked throughout the day at this auditorium, and I was asking, and I'm a physician, I was asking, who here has hypertension? Who here has diabetes? Who here has high cholesterol? And I wouldn't be doing a good guess. But if I ask who's here over the age of 50 or who's below age of 50, all of us will do a pretty good job. And the point is that aging has a biology. And this biology can be targeted. We can delay aging, we can stop aging, we can reverse aging in several instances. And this is what I want to talk with you about today, and also to make sure that you understand that there are benefits from that. But before the benefits, let me make several points. The first is that aging is the risk factor for most of those diseases that we are afraid of, from cancer, from heart, from Alzheimer, from diabetes. Now, you'll tell me, no, just a minute, cholesterol is the biggest risk factor for heart. Cholesterol is a threefold risk factor for heart. But death from heart disease is 1,000 times higher when we age. This is the major risk factor for heart. And aging is the major risk factor for Alzheimer, diabetes, and cancer. And the point here is that aging, or the biology of aging, is drive those diseases. So we need to stop the aging part in order to prevent all those diseases. What's happening now is terrible, because if you look at accumulation of 3 diseases, okay, we're talking about multiple diseases, and this graph shows accumulation of 3 diseases. So people have 3 diseases. Each disease might be terrible. Each disease has a treatment that has side effects. And then you have 3 treatments that all are interacting with each other. We cannot go on and live like that. And there is a clear alternative for that. what we need to do is start targeting aging so that we can actually drop down this accelerated rate of getting a disease. We have a major problem that FDA doesn't recognize aging as a prevented disease, or as we say, doesn't have an indication. If aging is not recognized as a preventable disease, two things are going to happen. First of all, the healthcare providers don't have to pay the customers. They should if they do the economy, but they don't have to. But more important, the pharmaceuticals are not going to jump in where you don't have an economical plan. So one of our obstacles now is to actually get the FDA to approve aging as a preventable condition. How are we doing it? Well, we're a bunch of scientists that created this study that's called TAME. TAME stands for Targeting Aging with Metformin. Metformin is a common drug to treat type 2 diabetes, and it's a generic and cheap drug. In fact, metformin is the cheapest drug in the formulary in the United States. Still 10 times more expensive than in Canada, but it's really cheap. Why metformin? Well, when you give metformin to a variety of animals, they will live longer and healthier. And there's a lot of biology. In fact, metformin hits most of the hallmarks of aging, whether it's primary or secondary. But also, there are lots of clinical studies that shows that metformin prevents type 2 diabetes. It prevents heart disease in diabetics. It's associated with less cancers in diabetes. It delays cognitive decline in Alzheimer's patient or MCI patient. It even has lower mortality. People on metformin with diabetes die significantly less than people without diabetes. Even if they have diabetes and they're more obese and they have more disease to start with, metformin prevents this mortality. So there's a lot of data, clinical data, to support that metformin is a drug that we can repurpose for aging. So what we're trying to do is two things. Use metformin as a tool, and I'm saying it like that because it's a tool in order to show that aging can be targeted. Even more important, use it so the FDA will have an indication to delay aging. And we've talked with the FDA, and we have a way to proceed. We hope to start the trial very soon.
Life Extension magazine brings you new discoveries in health and anti-aging. Our science-based research and supplements are so advanced they're many years ahead of the medical mainstream, with quality control standards that exceed FDA mandates. Life Extension has covered groundbreaking medical research for more than 35 years. For your health and future, you deserve the best. Learn more at lifeextension.com.
This concludes our special update on health. I'm Richard Peretz. Thank you for being with us.